Well, new concerns today following the release of a major study we told you about yesterday. That study says that 74% of doctors plan to retire, go part-time, or seek other employment in the wake of the new health care law. If that is true, they say this could mean less care for patients. Joining me now for a fair and balanced debate on this, Dr. Mark Siegel, member of our Fox News Medical A team, and Dr. Cathleen London, a family practice physician. All right, so Dr. Siegel, we talked to you about this yesterday, and you believe the study. You say it's by a legitimate group, and you say it does cause a lot of concerns about the exodus of physicians, and that those of us trying to find private practice physicians in particular are going to have a tougher time. But Dr. London, you say not so fast. Why?
Well, you have to look at where this study was done. It was done only from AMA members, which is maybe 25 to 30% of all the physicians in the U.S., and they only had a 2% response rate. So it's selecting right there out of bias. And most of the AMA members tend to be older physicians who've been in practice a long time and are used to things the way they were, very much fee-for-service in the old style, and have not wanted to progress anyway. And most of the things that came out of this study are, in terms of the retiring, these were happening long before healthcare reform. There's been issues with reimbursement. There's been issues about shortages long predating healthcare reform.
Because you mentioned something important, which I forgot to mention in the intro, which is they say the reason they're doing this is in the wake of the Healthcare Reform Act. That's one of the main reasons they cite. Let me just point this out. I did ask our Fox News polling team. They surveyed 100,000. They got 2,400 responses. The Fox News polling team says that's actually pretty decent.
Actually, 40,000 it was sent out to 40,000 AMA members.
Even better, decent response rate, though. But in terms of polling, they got a decent response rate, but you can argue about whether the sample was too old or so on. Dr. Siegel?
First of all, I actually think the AMA, since it supported health reform, I'd be more worried about non-AMA members and what they have to say. Second, older physicians is exactly what I'm worried about, people that are used to quality of care, because 60% of those surveyed said that quality of care is going to be affected here. You're going to have less time to spend with their patients. Now, Dr. London and I are actually a great example of what I'm worried about here. Dr. London used to practice in Boston. She's now joined the Cornell faculty. She needs to go to a bigger medical center in order to be able to keep the kind of care going that she wants to do. I actually talked about that yesterday. Myself.
You did predict. That's what you said would happen. I said the doctors are just going to quit after all their training. You said no, they're going to go to hospitals.
Look at me. I have a source of income here. I see patients, of course. I maintain my quality of care for my patients by having other sources of income. The fact is that medical practice is changing because we weren't asked and we aren't equipped to handle this health reform.
Go ahead, Dr. London.
Okay, I agree that practice is changing, but I don't think you can put this all to healthcare reform. We've had issues with reimbursement going back. You can go back to 2004 and see studies by the American Academy of Family Physicians, by the American College of Physicians, of changes. This goes way back. It goes back to how we started reimbursing physicians, how when Medicare came in and then private insurers with revenue-based and trying to do it in a different way. So we only, in some ways, have ourselves to blame. Doctors have not been good, mostly because we're
What about that, Dr. Siegel? Because my doctor, my OB, who I love, who you know, Dr. Elizabeth Eden, she says she went to cash only. She doesn't take insurance well before the health care law passed.
But she's actually making my point, because the health care law is going to add 30 million people on top of the problem, rather than looking at why we were going in the wrong direction beforehand. More and more doctors were dropping out of insurance. You can't find a psychiatrist that takes insurance. Dr. Elizabeth Eden is a wonderful physician, but what about those that are hucksters, that are out there saying the only way that I can make a buck is having a boutique practice, selling some charms, selling some herbs or some hormones that are not actually studied? I'm worried about standard of care. I'm not a big fan of health insurance, but at least it set up a certain quality across the board.
Here, can I just read this email? I got to go, but I want to read this email to you quickly. This is from Susan, who lives in Texas. She writes, I'm disabled with MS, and Medicare is my only insurance. Since August, I've lost 2 doctors due to the government. One will no longer see medical care patients unless they have Medicare Advantage insurance that I can't afford. The other closed his practice altogether. So she's saying she's actually seeing this happen. She's having trouble finding a doctor in the wake of the law. And to her, you say what, Dr. London?
No, it's not from the law, though, because if you look, it's about right now, most physicians spend about 3 weeks a year on paperwork from insurance companies, because they usually are with 12 different insurers that all have different rules on both on reimbursement.
Did the health care law help or hurt that?
I don't think it changed it. I don't think it affected it. I don't think the health care reform is addressing some of the major problems like the Medicare SGR and things like that that need to be addressed. Sustainable growth has to be addressed. We need to do any liability reform because nobody wants to start taking care of more patients
but you
if
said
we're held liable.
You used to be an OB. You know about liability, the need for liability reform. I got to go, but Dr. Siegel, I can see you're itching to get into work.
The law adds many more requirements, much more paperwork, a lot more to do to get a Medicare service approved. That's one of the things that's going to choke us. So I think it's continuing to move us in the wrong direction. We're not streamlining things.
Okay, listen, that was great. Thank you both so much. I like to get both perspectives, and we appreciate both of you.
She's a good doctor, too.
Amen to that, sister. And I feel in very good hands here. I said, God forbid this baby decides to do anything early. But no, it's too early. In any event, moving on. There are new estimates coming out on the cost of this big tax deal in